there's electricity, but there's no contraction and no pulse. The next step after that is the electricity dies and you get asystole. What happened, why I think that's where Dr. Murray found Mr. Jackson. We're going back to the heart. He reported in his report that when he left Mr. Jackson's side, the oxygenation percentage was in the high 90s, which was normal, and the heart rate was 70, which was normal. He stated he left for 2 minutes. And so when he came back, Mr. Jackson wasn't breathing, and the heart rate was 122. But we know there's a blood pressure for 2 reasons. One, he checked a pulse, and indicated as a pulse, that means there's a blood pressure. A pulse oximeter will not detect a heart rate unless there is a blood pressure. So we know there was a blood pressure. There was no automated blood pressure cuff to tell us that there was one. So when he approached Mr. Jackson at this point, what he should have done was first called 911, run over, try to arouse Mr. Jackson. Sometimes we do a sternal wound that arouses the patient. He should have grabbed the ambu bag, tilted Mr. Jackson's head, make sure he wasn't obstructed, and start using the ambu bag with a positive pressure and trying to get the oxygen up, reaching and finding his flumazenil, and then giving him flumazenil immediately as soon as he can. What he did do also, which I think is inexcusable, he started doing chest compressions. As I told you, there was a blood pressure. When there's a blood pressure, this is a respiratory arrest. This is not a cardiac arrest. So the heart is still contracting. The key is, remember, you want heart to get oxygen, because without it, it's going to stop. So instead of just calling 911, instead of immediately giving flumazenil, instead of using the bag mess to get oxygen in him, he started doing chest compressions, which is counterproductive on a heart that's already working. So the fact that he was doing that was an extreme deviation from standard of care. The other thing is that his CPR were poor quality. If you guys feel your chest, it is hard. And in order to get good chest compressions, you got to go 2 inches. Could you imagine doing that with one hand or underneath a soft bed? You can't. So he should have put Mr. Jackson on the floor, because he didn't have a backboard, and done CPR on the floor with 2 hands.
And you're aware that Mr. Jackson weighed 136 pounds, correct?
Yes, sir.
And how would Dr. Murray, with his size, place Mr. Jackson on the floor to do appropriate compressions?
Gone behind him.
Just a moment, please. Once again,
Sorry.
It's very important for both parties to just wait till the other speaks. Please, a question and an answer.
Thank you. And the court reporter needs to get down everything we're saying, so we have to. So you're aware of Dr. Murray's size, and you're aware that Mr. Jackson weighed 136 pounds. How would Dr. Murray put Michael to the floor?
I would get behind Mr. Jackson and slide him down.
Okay. And you would get behind, I assume, his, Ms. Brazil doesn't mind, his torso area and under the arms, and just protect the head and let the feet drop?
Yes, sir.
And that would be a very easy procedure?
I would think so.
Now, you also commented in your findings regarding, well, let me just ask you, so what you've described during the arrest, according to Dr. Murray's own words, the heart rate that he observed, what he should have done as far as calling 911, arousing Mr. Jackson, using the ambu bag, going immediately to the flumazenil, placing him to the floor, doing appropriate 2-handed compressions with a hard surface. All of these actions during the arrest indicated, the failure to do these actions indicated to you gross negligence and an extreme departure?
Yes, sir.
Now, the 5th extreme departure you've identified was a failure to summon emergency help, which you've commented on briefly. Explain that for us, please.
Yeah. It's basic knowledge in America. You don't have to be a healthcare professional. That when someone is down, you need to call 911 for help. Dr. Murray should have known that. When he saw Mr. Jackson down, he should have known, I have none of the equipment to help Mr. Jackson. I have none of the medications. I have no help, any other personnel, medical personnel that can help me. I need to get help quick. And one of the first things you should have done is call 911. There was a significant delay in calling 911. I understand he could have called 911 at the beginning code around noontime, but then there was a significant delay to calling anybody at all. And then when you call 911, instead of calling 911, he called Mr. Amir. Mr. Amir?
Michael Amir Williams.
Michael Amir Williams. Mr. Michael Amir Williams. Instead of calling 911 and saying, I'm at 100 Carrollwood, come fast, I'm a physician, we're giving CPR, come on over, he calls his assistant, and there's a further delay of at least 8 or 9 more minutes.
And let me stop. And you're aware from, again, Dr. Murray's own words, that he admits that he didn't even ask Mr. Williams to then call 911.
He did not ask Mr. Williams to call 911. And apparently, the paramedics, the EMS, Emergency Medical Service, they were only about 4 minutes away. So instead of that huge 20-minute delay, I didn't even count, 20-something minute delay, he could have gotten help that he needed within 4 minutes.
As a cardiologist, in this type of situation where you have respiratory depression leading to eventually cardiovascular failure, describe the significance of even a 30-second delay or just a 1-minute delay in making that 911 call to get the necessary equipment and assistance to the site.
Yeah, we have statistics. I'm not well versed at it, but for every minute that there's a delay in calling EMS during a code situation, there's a less and less chance that that patient will survive.
Every minute counts.
Every minute counts.
And even if the delay, even if the patient may survive, you could have permanent brain damage by delays.
Absolutely. Yeah, yes, sir. If the brain doesn't have oxygen for about 10 minutes, there starts to be permanent damage to the brain.
Now, you said in your report in regard to the failure to immediately call 911, you actually described Dr. Murray's behavior as, quote, bizarre. Can you elaborate on
I just thought it was strange that a medical professional who needed help should recognize the fact that he needed help, and then when he had an opportunity to call for help, he did not call 911. He called an assistant. When he could have, in that short time that he had a conversation or used a call, he could just call 911, put even the phone on speaker, and be able to work at the same time as talking to EMS and help.
And an additional then extreme deviation from your report, you note, is the failure to maintain proper medical records. Can you describe that, please?
Yeah. I want to describe why. He asked me why we give medical records, why it's important. There's 3 reasons. One, our insurance, the first 2 are not so important. One is the insurance companies who want us to document because they want us to document and justify what we get paid and when we order tests. The second reason is litigation, meaning anytime there's a conflict, let's say with a patient, we have documentation of exactly what we did. But the most important reason why we document is to take better care of you. When you come to see me, I write down your complaints, your history, your allergies, go over your medications. We take your vital signs. I do a physical exam and write it down. I go over your lab work. I go over any diagnostic tests you had done. Then I make an assessment and I make a plan of action. If I do a procedure on you, again, I get informed consent, I discuss the procedure, risks, benefits, and alternatives, and I have you sign that you understood that. And when I do a procedure, we have everything documented what exactly happened. And why is that? So when you come back, first of all, I know what's going on. Because I can say, oh, you know, how is your breathing now? Oh, you know, I'm not going to give you that medication because you had a reaction to it. Your blood pressure was high last time. You know, I didn't hear that on physical exam. Your blood count's down. Your EKG looks different. The other reason is that other people can take better care of you. If you move to San Diego or I send you to a consultant, they have everything. If you come to the emergency room, our emergency room at night, my partner can pull up your medical records and he can know exactly what's going on with you so he can take better care of you. Dr. Murray did not document a single thing. He didn't document, you know, Mr. Jackson, when was the last time you ate? Because he's giving propofol. And there was no history. There was no vital signs documented. There was no physical exam. There was no informed consent, meaning, Mr. Jackson, do you know I'm giving you this powerful medication, unmonitored? Do you understand the risks and benefits? He didn't have one single vital sign while giving this medication. We always write down what medications we give and their reactions. And when he came to the emergency room, he was confused and didn't have all the information that he could give to the emergency room doctors at UCLA about what exactly he gave.
Now, you're assuming that was...
Just have a moment. The mic went out. Deputy Jones needs to reset it. Give us a moment, please. Steinberg, want to just flip the mic, see if it's working? Good. Thank you. Sorry.
Dr. Steinberg, you indicated he was confused at UCLA. The other option is he was simply being intentionally deceptive, correct?
It could be. I don't know.
And again, because you're basing your analysis...
I'm basing my analysis...
Let me finish.
We need the question.
Sorry.
You're basing your analysis on the words of Dr. Murray and giving him the benefit of the doubt, interpreting the evidence as he explained it.
Yes.
Whether confused or dishonest, Dr. Murray did not have the medical records to provide to the caregivers at UCLA.
No, it would have been appropriate for him just to hand over the records. This is what Mr. Jackson got at what time. This is his history. This is what he's on. This is what he's allergic to. And then the doctor would have had all the records of what happened.
Now, in reviewing these multiple extreme departures or findings of gross negligence, you concluded in your report that the breaches of the standard of care directly contributed to Michael Jackson's untimely death.
Yes, sir.
And what did you mean by that?
Well, all those deviations, giving propofol in an unmonitored setting without personnel, without appropriate monitoring, without the appropriate equipment, not being prepared, not doing appropriately reacting to the arrest, not calling 911 on a timely fashion, all directly impacted his life. Because if these deviations would not have happened, Mr. Jackson would have been alive.
And when administering benzodiazepines, as Dr. Murray said in his interview, and let's just assume only 25 milligrams of propofol, since you're basing your analysis on Dr. Murray's words, in that type of administration in this setting, isn't it absolutely normal and foreseeable risk that you could have respiratory depression and potentially cardiovascular failure?
Yes.
That's a normal, reasonable